Hi, I am Dr. Garcia Roca. I am a transplant surgeon and director of the kidney transplant program.
I am Dr. Lucia de Gregorio, and I am a transplant surgeon.
And I am Dr. Jim Lau. I'm a bariatric surgeon and the regional director for bariatric surgery, and we are all from the Loyola University Medical Center.
Thank you for joining me, Dr. Garcia Roca and Dr. Lau. We are here today to talk about a new initiative that we are hopefully launching in the beginning of 2024, which is our metabolic transplant surgery program. And it is a collaborative effort that we are taking on between the weight management program and the kidney transplant program at Loyola to treat these two increasing health problems, which are end-stage renal disease and obesity. So I would like to start asking Dr. Garcia Roca about the challenges that patients with high BMI and chronic kidney disease face these days, and why do we think that it's important to develop targeted programs for them?
The combination of renal failure and obesity is not a good one. There are limitations to the transplant procedure in many institutions where patients might need to be losing weight before getting into a transplant. And it is very, very difficult for patients that are generally have anemia, low energy levels in general because of the kidney disease to try to exercise, as well as they also have a very a variety of limitations on their diets because of the restrictions due to being on dialysis and a combination of diabetes. So it is a very hard combination, and not a lot of obese patients that are in renal failure are able to access transplantation. So we wanted to, create a system where we can do, we can proactively do something to favor that transplant for this kind of patient population.
Yeah, I agree that we need to, as physicians, kind of adjust to the reality of the patient population we have. And so the old archetypes in which transplant programs were just declining patients above a certain BMI, that type of approach has to switch and has to transform to try to reach as many patients as possible, including high BMIs. And I wanted to hear from Dr. Lau. What are the challenges that you face when you have to speak with a patient that, on top of the obesity problem, is dealing with dialysis, and what are the concerns you have when you're considering surgery for them?
Well, I think overall, those who have higher BMI, those who are morbidly obese or has a BMI greater than 40, have significant challenges kind of with every medical problem. So every medical problem, including hypertension, diabetes, and a lot of those medical problems actually help contribute to renal failure, are affected by people who carry extra weight. So we feel like everybody, including those with renal failure, would benefit from losing weight or getting help in order to do so, not just to be able to qualify for certain transplants, but also to hopefully maintain a healthier lifestyle so that they can keep their transplant or their graft as long as possible, so that they have a long and healthy life with both with both disease processes.
Hmm. Yeah, I
I
think
mean, the
that.
challenge,
Excuse me.
right? I mean, the challenges. Sorry to specifically answer your question. I think are that most transplant programs require a lot of work by the patient and a lot of things that they have a lot of hoops to jump through. And the bariatric program also requires um, a lot of patient interaction and compliance. Diet and exercise are kind of mandated with medical and surgical weight loss programs, which require a dietitian, visit every month for up to 3, 6, sometimes 12 months by the insurance. And then a lot of tests, including endoscopies, EKG, right upper quadrant ultrasounds. And some of this can be very daunting when there are two programs that a patient's trying to go through. I think both of our programs and in unison can help them with this. And I think this collaborative, I think, is going to be very, very helpful for the patient.
So yeah, I couldn't agree more that both the weight management, whether it's medical or surgical process, have a lot of workup, a lot of nuances when it comes to insurance and steps that the patient needs to take in order to achieve weight loss and maintain it. And similarly happens with the kidney transplant process. And so I think it's really going to save a lot of time for the patient, hopefully, and also just the feeling that we're there with them, kind of going through this process, so they can actually see that we are very invested in their success, not just with the transplant, but with a healthier lifestyle. And I think it's key what you mentioned, that if we can help them decrease their cardiovascular risk, their respiratory problems, their diabetes control and hypertension, they are going to ultimately increase their overall survival and the graft survival. Because as we mentioned at the beginning, we don't have that BMI threshold restriction that other programs might have. But it doesn't make sense if we just go ahead and do a transplant and don't care about the overall health of our patients.
I agree. I think that's one of the biggest points to try to collaborate and help, because, like you mentioned, we don't have a BMI that to restrict patients from getting their transplant. We're using our robotic platform to achieve transplantation safely, but we still have a big problem to deal with, which is that obesity that has, another a larger set of comorbidities. And by actually addressing the base problem, whether it is right, before going into transplant or after the transplant, it is something that we can help to improve the overall health of the individuals, and hopefully with the intention to keep that health status for a longer time and cause less damage to the kidney as it has been transplanted.
Mm-hmm. I think another important key point for physicians that want to refer patients to our program is how we're going to navigate this. I think it's important to um, transmit the message that the patient still needs to proactively register with the weight management program, and that from there, us, meaning transplant providers and bariatric providers, we're going to look into their intake forms and look into the patient preference and determine whether we're going to prioritize medical weight loss or surgical weight loss, and where does the timing of the transplant fit in when we're talking about pre-transplant patients, eh, or if it's already a patient that has successfully had a kidney transplant, how do we get them to be seen by all these specialists? So maybe, Dr. Lau, if you don't mind explaining a little bit, uh, who are those specialists and providers that typically evaluate and participate on the care of patients with high BMIs?
So our program is very similar to other weight management programs, which incorporates a medical and surgical arm. The important thing to know is that even the surgical arm of the program begins with the medical. So that's the most important. When we talk about medical weight loss is assistance with diet and exercise. So having the help of a dietitian with making healthy choices, as well as getting a team around you to show the patients what the importance of not just exercise, but just physical activity, like walking 15 minutes a day. And then seeing a psychologist for an initial appointment, seeing a medical provider, either an advanced practice provider or one of our bariatricians that may be able to add medications as a multimodal therapy for people who have increased weight. And by starting the medical weight loss program, if after 3 months, 6 months, 12 months, the patient doesn't feel like they're getting the results that they would like, then they haven't lost any time, because if they registered through the program and has gone through a lot of the insurance verifications ahead of time, then at the end of the medical weight loss program, if they decided they need help with surgery, then we would go ahead and do surgery.
Mm-hmm.
And then, of course, there are multiple choices for that surgery. And then, just like Dr. De Gregorio and Dr. Garcia Roca talked about, the timing of their kidney transplant would also go into the mix, whether it's whether they're going to have the transplant or whether they've already had the transplant and are undergoing weight loss management.
Mm-hmm.
But it's a multidisciplinary team. And in addition to the transplant team, if the patient is being managed by an endocrinologist or needs the help of an endocrinologist, then we would connect them with that. If they're successful with weight loss and they would require a plastic surgeon to help with the extra skin, then we would make those referrals. We have all those specialists as part of our team at the Loyola University Medical Center.
Mm-hmm. Yeah, that's excellent. And Dr. Garcia Roca, when you evaluate a kidney transplant patient, let's say with a BMI above 40, and the patient's being referred to Loyola Medical Center because their PCP or their nephrologist knows that there's no BMI cutoff at this center. And the patient also talks to you about the possibility of having a living donor. They already have a friend that's expressed interest. What do you typically advise? What do you have in mind as of to how things should follow each other in terms of once they are approved for transplant? How should we proceed?
Yeah, I think that's a really interesting question. In collaboration, we have decided that the transplant should come first to reestablish, some part of the health of the individual. We can do that using our robotic kidney approach, and the patient would recover very quickly after surgery. It restores their energy levels, and if they don't have any specific complications after the surgery or related to the medications that we must give after the surgery, then promptly we can advise to go through that program. I think the approach would be to start the weight loss program referral process before the living donation happens and not really interfere with the transplant itself, just kind of in parallel work in both programs as much as it is, feasible. If there are any issues, we may need to pause the medical weight loss program related to the medications. But if we see that there's no interference with the transplant, then both events are occurring at the same time, and that way patients are not really having to wait for one thing to happen and then go contiguous to the other thing. We are just going to try to work together in parallel so then we can help as soon as possible.
Perfect.
What do you think, Dr. Lau?
Oh, I think that's perfect. I mean, that's why we are trying to meld the programs, because there's a lot of similarities. And I think to solidify the communication between the two programs for a patient, I think will enhance their experience and hopefully cut down on some redundancies that happen in other programs.
Exactly. And I think also it's going to make it a little bit more individualized, taking into consideration that, sure, some patients will come with the possibility of having living donor donate for them, but others might have to wait an average of 4 or 5 years until they are really up on the wait list and they start getting kidney offers. So I think it's important to get involved with the patient and to help them in the meantime as much as possible improve their overall health by achieving a better weight, a healthier weight. So for those patients that don't have that option of a living donor, we will work more proactively on attaining a healthy weight, and we'll put more emphasis on the medical weight loss plus or minus surgery if the multidisciplinary team decides that that's the route to take. So I think overall is a program that is going to take the best out of both houses to try to bring something unique and individualized for every patient, and hopefully get them to better outcomes, not just when it comes to their kidney function, but also with their overall comorbidities and health status. So we're really looking forward to these and just kind of be more participative on their care instead of just sending them out there, say like, come back when you've lost some weight, and we'll talk about things. So I'm hoping that patients will receive this very positively. So if patients want to get started in this new metabolic transplant surgery program, the first step would be from either the dialysis center, the PCP, or the patient themselves to send a referral to the Loyola University transplant program. And there's also a phone number, and I'll say it out here, is 708-327-3700, 708-327-3700. And from there, we will start the kidney transplant evaluation, which of course is the main goal, to be able to transplant these patients no matter what their BMI is. And for the patients that get approved for transplant, we would start the registration into the metabolic transplant surgery program. Thank you for viewing. I am Lucia de Gregorio.
I am Raquel Garcia Roca.
And I am Dr. Jim Lau, and we are all from the Loyola University Medical Center.